Hello, welcome to everyone. On behalf of AMMA Healthcare Research Gurukul, I would like to welcome you to this new series that we are starting. And this is a series that will focus on healthcare research methods, the research that is happening in healthcare with a specific focus on India. And we'll be looking at challenges, we'll look at opportunities, we look at what's good and we look at what can be improved. Our opinions on what can be improved and what must be improved with respect to healthcare research in India. Now, these are sort of like conversations to myself and to our group. And they're not hardcore solutions. They're not expert opinions. They're not things that are cut and dry, that take it, do it, and it all will work well. Sort of like trying to put things out there and then get people thinking, and more people to start wondering what can be done. And that's what we aim. Now, healthcare in India is an interesting space to be in. It's an interesting space to be in because of the sheer scale of opportunities that exist. We have a large population, more than 1 billion people in India. We add about 70,000 newborn children every day to this huge population. And so we have a huge population. We have enough numbers that can be studied. Sadly, unfortunately, we also have a huge burden of disease, illness. We are in the top tier of the global rates for most illnesses. We have the highest number of preterm births. We have a very high rate of preeclampsia, pregnancy-induced hypertension. We have a high neonatal mortality rate. We have high infant mortality rates. We have high maternal mortality rates, low birth weight, non-communicable diseases, diabetes, hypertension, cardiovascular diseases, strokes, mental illness, cataracts, you name it. We are up there. And so we have a huge burden of disease. We have a large population. Now, the interesting part about this is that we don't seem to have so much of original research that has come out from our country on these conditions. And it's not just original research that has come out. I want to qualify that. There might be a lot of studies that has come out from our country, eminent doctors, eminent scientists that have looked at various aspects of it. But I'm looking at it from a different perspective. Studies that have come out and translated into better healthcare solutions for our population. Studies that have come out and translated into solutions that have helped reduce the burden of disease that we have, that have helped improve access to care, affordability of care, reduce inequalities and iniquities in healthcare resources and resource distribution. We have not really looked at how we can improve our medical curriculum beyond the conventional boxes. We have not looked at whether these or the existing curriculum actually translates to better healthcare for our population. And that's an area that we need to start looking at. 70 plus years after independence, I don't think any true-blooded Indian can really be happy about the situation that we are in. And there's no point in trying to blame anyone. We are all part of the solution. We are all part of the problem. There's no point in trying to say it's all because of the healthcare people, that they should have done all of this. They should have looked at all of this. There's no point in trying to say, well, people do not follow what we say. People do not comply with our advice. Those are immaterial things. Those are things that matter, but those are things that we have to overcome. And we need to start looking at solutions that matter for the vast majority of people on the ground. One aspect of healthcare that really needs to come up is its intersectoral and interdisciplinary approaches or alignments. Medicine, in the practice of medicine, is not an isolated pillar by itself. It's not something that just says, well, here's a disease, here's a cure. Take it, off it goes, done. Maybe that's the way it's being practiced in some situations, or probably in many situations, but that's not its primary purpose. The primary purpose of medicine is to understand what's going on, to evaluate what's going on, to look at the whole and manage the details while keeping an eye on the primary care, secondary care, tertiary care, advanced tertiary care, preventive care, all have their role if the healthcare infrastructure has to really flourish. It also needs the people who are involved in it, and that doesn't just include doctors of a particular denomination alone. It needs people of different denominations in terms of their expertise, in terms of their skill, to be participating in the whole process. It includes people from the primary care level, and it's not just doctors, even the people who are there in the primary health center, participating in the primary health center, secondary care center, district hospitals, medical college hospitals, primary through tertiary care. All of them have to be involved and participating in the whole process of trying to understand what is happening and informing what's happening. And that means we need to be able to be looking at data with a pragmatic, realistic view, not with a judgmental view that then makes us feel that, well, we have to hide this part, it doesn't make us look good. We have to hide that part, it doesn't make us look good. But with a realistic, pragmatic view to see how we can use that to further improve. Of course, stakeholders, that's our communities. And we are part of the community. So when we improve our communities, naturally we improve ourselves. So there is no reason not to do that or to forget that very important part of healthcare and research. Another important aspect to keep in mind is that many people equate research with the exotic, study of rare conditions, study of rare things, futuristic. We all are now interested in artificial intelligence. It's a given fact that we are not using our existing intelligence well enough, but we are interested in artificial intelligence. We are interested in deep learning, machine learning, algorithms, mathematical permutations, modeling, a whole set of things. What we need to simultaneously build is our base of knowledge about the common problems that exist in this country, the common problems for which common people, most of the people, need solutions still. Malnourishment, poverty, diseases of poverty and diseases of hygiene, infectious diseases, poor access to medications, spurious medications, fake medications, poor access to care. There's no doctor for a large distance. There's no way to reach a hospital in time for a large segment of the population. These are things that have to be looked at, and these are things that have to be understood. And research is the understanding of something. That's all that it is, whether it's a new thing, whether it's an existing thing, whether it is futuristic, whether it's in the present. Research is searching again and again for the truth. And once you find the truth, then you're going to evaluate it. And you're going to see whether that is true or not, and whether you can apply it. And once you apply it, you evaluate it. And science is not about finding the perfect solution. The perfect solution happens, that's brilliant. It's rare. It's about minimizing uncertainty. It's about minimizing errors. And it's about using that process of minimizing errors to gain a better understanding and to see newer directions that can help to further minimize error. Till a point might come where we can say with conviction that we have taken care of something. But given that we live in a human body and we have a human mind, and we don't know much about a large section of the mind, a large section of the brain that controls the body. We don't know a lot about the functioning of the brain. There still remains a lot of things that we don't understand. And so a large part of our work is focused on trying to minimize uncertainty. So the methods that we use are important. The methods that we use are what creates the evidence. And that creates the base for that, shall I say, constant refrain that we say that we are evidence-based practitioners. The two aspects to it. The evidence has to be robust. The evidence has to be evaluated. And we have to understand the evidence. So this series of talks is focused on looking at the evidence, looking at how we generate evidence, looking at how we understand evidence, looking at how we assimilate, evaluate evidence. How do we apply it? And a whole set of things around research, around healthcare research, and its integration with clinical care and clinical practice, its integration with public health care and practice, and its integration with other disciplines, including the social disciplines, ethics, environmental sciences, nutrition, and other disciplines that combine together to make for a good and robust healthcare system. So we hope to see you with us. We'll do these talks once a week. It'll be a free-flowing discussion, monologue, I might say, on various things. And we'll leave you with questions. And we'll encourage you to write back to us with questions that you have. And we'll try to incorporate those into the discussions that we are having. So see you again. Thank you. Wish you all the best. Stay safe. Be happy.